Okay. Yeah, good morning, everyone. It's March 20th, 2025. We have our Department of Job and Family Services with us once again, and we thank you for being with us.
Could one of the two of you go in there? They just need a quorum for that.
Yep.
And then come right back. Okay. Thank you.
So Scott, Garland,
Good
thank you for
morning.
being here, and if you'll say your name for those who are watching the
Sure.
video or checking in. So
Thank you. Thank you for having us, Bill. Scott Boone, the Director for Knox County Job and Family Services.
Carla Poland, the Public Assistance Administrator for Knox County Department of Job and Family Services.
So as part of our tour to continue to update you on each department, I asked Carla to come down this morning, talk about public assistance and some of the great work that's occurred in her shop in 2024. Some of the things that are going on now, and maybe a couple of things that you've got planned coming up. So Carla, go ahead.
Okay, first I'm going to give you the year-end review for the PA unit for 2024.
and the PA is.
Public Assistance, I'm sorry. Thank you.
You're welcome.
I do. Minutes, thank you.
You're welcome. Okay, I'm just gonna give you, we're not gonna go over this report completely, but as you look at it, if you have any questions, you can get with me. But I just want to give you a quick overview of the Public Assistance Division. We administer a range of complex programs, each with its own set of policies that must be followed. The systems we use do not always process cases accurately, so it's essential for caseworkers to have a deep understanding of all the required policies and budgets. Some may perceive our caseworkers as just a data entry clerk, but in reality, it's far more complex than that. Training for a new worker takes over a year before they completely can process cases. I mean, that's how long the training really does take before they understand how to process a case. Medicaid in particular is the most complex program we manage due to the many categories that need to be considered. The programs that we're over is SNAP, Supplemental Nutritional Assistant Program, food assistance as we all know it, TANF, Temporary Assistance to Needy Families, Medicaid, nursing home, fraud, and back to school. I'm going to give you a quick overview of each one of these. Fraud, just an interesting fact, is we recoup approximately $1,600 per month from SNAP benefits from overpayments. And we recoup that as they get their food stamps. Their food stamps are decreased.
And can you speak a little bit about the state plans for the chip cards and last, I think we were told, and maybe you've heard something else, maybe not. They're considering going to the chip cards. There's about a $5 million expenditure for ODJFS with a $5 million match from the federal government. That's expected to significantly reduce opportunities.
The skimming and the fraud, yes.
Those different types of things.
Because we've had a lot of skimming. We talked about that before.
Mhm.
Right now, they're not replacing any food assistance that's been skimmed, but we actually only have two ever since they stopped that.
Okay.
Only 2 cases have been reported.
When you say skim, is that somebody stealing somebody's?
They're putting the skimmer actually at Walmart or
On the card. reader.
IGA
On
on
the
card
card
readers, and they put their card in there, and then they've got all the information they need.
Thank you.
Well, I noticed Walmart has like a red tape with this on there, and I didn't know whether that made that secure or whether.
That is
What the-
supposed to make that more secure, yes. Okay, for the SNAP program, Knox County has over 2,782 households on food assistance. And in those households, there's a total of 5,264 individuals. An interesting fact is Knox County, 12% of the population in Knox County is on food assistance.
What was that percent again?
12%. Approximately 11 million in SNAP benefits issued in Knox County each year.
Hmm.
The average food assistant payment per recipient is approximately $2,890, or I'm sorry, $2,089 per year. That's per individual.
Okay.
That's an average.
That's those 5,264.
Yeah,
that
That's,
Population average
yes,
is about
that's what they're getting, their averages.
2,000. Okay.
Yeah. Knox schools have a free lunch program, and there's a summer EBT. EBT stands for Electronic Benefits Transfer SNAP card. That's all done through the state. However, it assures school-age children will receive food assistance during the summer months. It's a completely different card than what our SNAP card is. It looks the same, however, it's considered an EBT card.
And they use them at the schools for their meal. Is that what you're
No,
saying?
they use them during the summer at
Summer.
the grocery stores, just like they would their SNAP card.
Okay.
And people, if they get free lunches at school, usually they get that EBT card. You don't have to be on SNAP benefits to get that EBT card.
Okay.
The requirements are a little different. Okay. So OWF Ohio works first. The same as TANF, OWF and TANF, you hear it, temporary assistance for needy families. 682,000 is issued per year. There's 13 adult recipients receiving TANF. There's 105 of child only. That is grandparents raising kids or a relative out of that 105. An interesting fact is you're required to work for your TANF benefits. Working for OWF does not meet the minimum wage per hour. Ohio minimum wage is $10.70 per hour, while federal minimum wage is $7.25 an hour. Working for TANF and OWF falls below Ohio's minimum wage. And another interesting fact about that TANF, of course, I've been here for a long time, but the number of TANF OWF participants has decreased way down over the years. As it used to be, we would have like 400 in Knox County, 400 TANF cases in Knox County. It is now 13.
Wow.
Of course, the 36 months had a lot to do with that, but it's continues to decrease. But back when I was a caseworker for those, we had over 400 cases.
Mhm. You have an explanation as to why?
The 36 months, I think, is a lot of it. You can only get it 36 months in a lifetime. Yeah, I think, and working for the benefits has a lot to do with it, because if you actually work for your TANF benefits, it comes out to $9.60 an hour if you work 20 hours a week, 80 a month. And then the 35 hours a week, 140 a month, you're actually making $5.40 an hour. So they're better off working. You're gonna make more money working.
So with that decline, did you see something jump up? Increase somewhere with that decline? Was there anything? No, so it just washed itself away. Interesting.
The SNAP benefits pretty much kind of stayed the same, but that TANF is really, I mean, we're talking years ago, but gradually came down. I'm sure they didn't all come off at once, but yeah, that's a really interesting fact for me, because it truly 400 to 13 is a big difference.
Mhm.
Okay, so then we have Medicaid, the complicated program. We have 12,075 Knox County residents enrolled in Medicaid. 19.25% of Knox County population is enrolled in Medicaid. The total Medicaid enrolled in the state of Ohio is just over 3 million. I have it broke down. It's not broke down in my year-end report that you guys have in front of you, but I broke it down by age just because I thought it was interesting. Babies, infants, there's 256. 1 to 5, there's 1,250. 6 to 13, 2,263. 14 to 18, 1,400. 19 to 20, 292. 21 to 44, 3,381.
How many? 3,000 what?
381. I'm going to explain that group to you here in a minute.
Okay.
45 to 64, 2,145. 65 and over, 1,089. That figure is very interesting because what that tells you is those 65 and over have to be really lower income in order to get Medicaid because they're also receiving Medicare.
Mhm.
So you have to be in the really low income to get that. And there's 1,086 in Knox County. The Medicaid by category. You have children only cases, and that's 6,674.
What's the CFC stand for?
Children, family. Okay, knew you'd ask me that, I don't know.
Yeah. Just,
CFC just means children that's receiving it.
Okay.
You have to have children. Children, family, and council is what CFC stands for.
yeah.
Yes. Expansion stands for adults. This is the interesting group that they seem to be discussing lately. That's the work age group 19 to 64. They are not disabled. They do not have any children. That's just simply adults receiving it. And there's 2,628 in Knox County. ABD dual is the age blind and disabled. There's 2,029 in Knox County.
And is that still the 19 to 64 age group or?
That can be any age.
Okay.
If they're age blind or disabled, that can be any age.
So it could be
The
a 1-year-old.
interesting about that other age group, 19 to 64, is those people are not disabled at all.
Mhm.
They do not have children. It's what in the old days we called it. What did we call it back then? They received assistance general work program. Do you remember that? Any of you? None of you are
That
as
was
old as I
before
am.
my time.
Yeah, it was before your time. Well, anyway, back in my time, that was the adults that were not eligible. And they stopped it so they no longer could receive money.
Okay.
However, they added back to where they could receive Medicaid. And I think they're talking about it now. If they take any Medicaid away, that'll probably be the first group that goes. Because they could work.
The big one was the 21 to 44. What'd you say, 3,381 people in that age bracket?
Mhm. Yeah.
What is?
But that's all of them combined it together. That's the ones with children, CFC children. Those are any of these numbers except the expansion adults. None of them are the expansion adults. The Medicare Premium Assistant Group we pay for their Medicare premium. There's 663 in Knox County that we do that for. You know how you have to pay Medicare premiums, we pay it for them. And then we have a group that is just called Other, and there's 82 in that group. What that group is they went to work. They're no longer eligible for Medicaid. They're over income. However, we give them transitional Medicaid. And it's depends on the circumstances. It's anywhere from 6 months to 1 year. They can still receive Medicaid even though they're really over income, because it's that transitional period time. And we only have 82 of those in Knox County.
On the Medicare premium, would that be in some cases also the Part A premium as well as the Part B?
Yes, yes. Yeah, Medicaid, there's so many different categories and so many different, it's really gets complex.
Mhm.
And also the eligibility, there's so many different factors that go into the eligibility. And that's why the caseworkers have to be really on their game when they're doing this, because the system, they're updating it all the time, but they can't always keep up with all the changes with the system. So the caseworkers have to know, is this correct or not? We also have a back to school program. And the back to school program is yearly. We partner with Interchurch. And it provides needed school supplies, clothes, shoes, and hygiene products to eligible Knox County children. It's TANF funded. Last year, it was approximately 220,000 that we spent for back to school. And we helped 1,425 children were served. Now, this year, we hope to expand it a little bit. Increase it so we can, because we actually capped it at 220,000 and we spent exactly what we had it capped at. Hopefully this year we'll maybe get a little bit more money, to help a few more children. And in my time, this back to school program has been wonderful. In the very beginning, the first time, you'd walk into Walmart and you'd see these kids, they were all excited because they were getting new clothing or new shoes for school. And you could tell that they hadn't, they wouldn't get any school clothes or new shoes if it wasn't for those vouchers. So it was really interesting to walk into the store and see the families in there purchasing their stuff.
So, yeah, going back to that then, so. Medicaid children, we have 6,674 kids in the county. Okay, so you would think then you would have 6,600, or some of those kids wouldn't be school kids, right? That are on the Medicaid children list.
Right.
Yes, yes.
Okay,
And some of them might not be eligible because it's different eligibility, and some parents may not even, I think we turned away, this is approximate, but I'm gonna say we turned away 50. Does that sound correct?
Mhm.
Last year, we turned away 50 families.
and it was last year when we had some people that made copies and were handing out to people, and we had that taken care of, and
Yes, and trust me, we have a new plan for this
Okay.
coming year.
Yeah, we have a new way to distribute the vouchers so that it will discourage what happened before. We did meet with Prosecutor McConville. As we've taken the alleged criminal activities that we've gathered and presented them to his office. And he's in the process of making a determination as to whether or not to file charges against the couple of individuals that were involved in.
So people were duplicating the voucher?
Yes, yes, and then using them over and over again. Fortunately, our internal fiscal people caught that the names and numbers were repeating themselves, and that's how we found out about it, to sort of get ahead of it. And then, as Carla said, it prompted us to create a new system to where we're gonna hand them out a bit differently. But as the momentum and the talk of this benefit to our community grows, that's why we've increased it last year and
Right,
hope
it's
to increase
increased
it
about every
again.
year. Yeah.
Well, just looking at that briefly, that camp was about $200 and change a child. Is that what that ended up being? Did you say
Was it
200?
175? What was
I
it?
think we upped it to 200.
Okay,
about
yeah, it was
200.
200, yes,
Pretty nice.
Yes.
yes.
Definitely.
Is there a way to get additional funding for that, or is that all federal? Down, I mean,
It's all-
because you had to turn 50 kids away, you said last year, so there's not a mechanism.
It's all
Okay.
TANF funding, it just kind of depends on, I mean, that's more fiscal, Scott, than me, but
And to answer your question, yes, it's just what we budget for. So we never want to turn people away. But we didn't anticipate that we'd get
right,
50 more people than we did, because even last year, we got an increase that we counted for some of that, but not the other 50 or so.
right.
And you mentioned working with Interchurch, so is that also Centerburg, Danville, Fragtown, as well as Mount Vernon
Yeah.
Interchurch?
Yes.
Okay.
Interchurch actually goes to the stores and gets all the contracts and everything with the stores so that we can purchase the merchandise. And then Knox County Department of Job and Family Services is actually the ones that actually give out the vouchers. But Interchurch is also there to help. We do it as a group, we do it together.
So they come here to your office to get the coupon?
No, they get the coupons printed and
They is Interchurch?
Interchurch gets them
Okay.
printed, yes.
Okay.
And then we give them out at the Nazarene Church every year.
Okay, and that's First Church in Nazarene?
Yes.
Monk shocked and.
Okay,
And they've been really good every year, allowing us to use their building, and I have no reason to think that they wouldn't allow us to use it continuously because there hasn't been any problems and
so set day, set time, First Church in Nazarene, families are notified by what, Knox pages, radio stations?
we advertise everywhere.
Social media platforms.
Okay.
And when people come into our office, I think we have signs posted in the
Yes.
lobby and there's individual.
Interchurch
conversations.
posted also.
Okay,
And we have to do it that way because it's first come, first serve.
Okay.
If you run out of money, you can't serve those families. That's why I said we turned away 50 last
Okay.
year.
Bit
With
of a
that,
heart breaker, actually.
yeah, it truly was. Cause I had to be the one there to turn them away.
Yeah.
So, yeah.
But you also redirect them to other community
Yes,
outlets
yes.
to where.
And Interchurch gets together and tries to help them and
Mhm.
Salvation Army is really good at, I mean, those families, we sent them, Interchurch says, come on down and we'll try to work with you. And then they
Okay.
send them to Salvation Army. So they weren't just absolutely turned away.
Good to know.
So,
Did you catch the fraud? Because that actually stole from those kids.
yes,
Yeah, good point.
yes, you're exactly right. So, but that's a really good program. We also have a call center. It's a collaboration of, there's 9 counties, well, there's 8 counties including Knox, well, there's 9 including Knox. And those counties are Morrow, Marion, Carroll, Hancock, Holmes, Harrison, Sandusky, and Wood. And we're a virtual call center. We've been doing this since 2011, 2012. And we do all of the intake applications, redeterminations, and customer service. All of that is done on our call center. And when a Knox County resident calls the call center, they'll get a caseworker, but it may not necessarily be a Knox County caseworker. It could be a caseworker from any of these counties.
Okay.
And we've got a pretty good system there, and so we run that call center. And we're required to take, Knox County is required to take the calls that they originated. In 2024, Knox County originated 10,382 calls to the call center. The calls we handled 11,528.
So originated means originated. by
It's a Knox
people-
County case and it's a Knox County person calling
Okay,
for an intake or customer service or something. But we're required to have a certain amount of people on the phones at all times. And we are also required to make sure that we take, in other words, we had to take at least 10,382 calls. If not, we weren't holding up our end of the bargain. Well, as you can see, Knox County handled ours because we ended up with 11,528.
Out of the 119,622, is that on this back page I'm looking at?
No, it's on, yes, the very last page. It shows you what all the other counties did, the calls handled and the calls originated.
And we're top three typically in call timeliness, volume of calls. You mentioned that we take a lot of other calls for other counties that sometimes have more capacity on the phones than we do, but somehow those still get routed to us. And do you want to talk a little bit about some of the staffing challenges you've had? I mean, this isn't almost an everyday type of activity where you very early in the morning or the night before, set up the schedule of coverage, and when you've got people out, last week or 2 weeks ago, you had 6 people out sick, talk about,
Yes.
Yeah. Yeah.
you know, how you manage that.
It's a challenge, I'll admit it's a challenge, but we have high standards in Knox County Public Assistance Unit. All of the workers also have that high standard that I carry. And we work together as a team and it's like, okay, we're gonna get this done. We're not going to take a hit for anything. We're gonna do exactly what the state wants us to do. We're gonna take our calls. And I come in early and another supervisor comes in early every day. And what we do is we look at all the work that needs to be done that day. Because there's some documents that have to be completed that day. I'm going to explain the application timeliness in a minute, but you have to get those docs done that day or you're taking a hit. Back in the time, I used to control it by telling the workers, if we don't get this done, we can't go home at 4 o'clock. We're gonna have to stay overtime. We haven't had to work overtime for years, no matter how low staffed we are. We've never had to work overtime because they don't really want to work overtime. And so they're really good at, hey, we got to get this done. So today we're going to give you 110, 120% because we know we've got 6 people out and we got to get this done. Last week was a real challenge with the 6 people out because we're in the middle of anytime that CA call center has something special that they need to do, they'll call on Knox because they know that my workers will do it. They'll do it correct and they'll send everything that he needs. The C8 administrator has to keep track of all these calls, keep track of how many's customer service. And so he's going through a pilot program right now. We're trying to separate the intake and redetermination calls from the customer service calls to figure out really how many calls, because what's happening is that the person will call for an intake or a redetermination, they'll hit the wrong keys, and so they'll go to customer service. And in the past, those customer service workers can do everything. So they would just simply do the redetermination and the intake. Well, then it's hard to figure out with the numbers, how many intakes and redeterminations did we really have? Because it went to a different queue. It went to the customer service queue. So for the last 3 weeks, Knox County has been conducting this pilot program for him. And we're documenting every single call that comes in. We're documenting, is it a redetermination? Is it an intake? But also what they've done, they just started this. If you have an appointment scheduled and you don't say that you have an appointment scheduled, then you're automatically getting pushed to the intake redetermination queue because you have an appointment scheduled. And that's how we're trying to fix it. It'll also reduce the wait time for those intake and redeterminations, because if you clutter those up with customer service calls and so on, then you've been scheduled for an appointment, but you're gonna wait longer for your call because they're all mixed up and they're not separated correctly. So that's the whole goal of this pilot program. This is the third week. We'll probably go live. All of C8 will go live probably next week because we've got all the bugs out of it.
So appointments being scheduled, does the individual send an email or to you to schedule an appointment, or do you send out? saying,
No,
"We're
we
gonna-"
send out letters to them and reschedule them.
Okay,
Yes.
and so they're told that on Wednesday, the day of the month at 10 o'clock, you call in.
Yes.
Okay,
And obviously, they don't always call at the required time. And so we do the interview whenever they call. It
Okay.
doesn't, that's another reason why we're trying to get the queues all straightened out so we can really tell what is going on with the customer service calls and so on.
how often do they have to do a redetermination?
It is once a year. But every 6 months now, they have to turn in something, like a paper stating there's no changes, and then we do that in the system. But they have to do the actual person redetermination once a year.
Then the paper is something they mail in, could they scan it?
They can mail it in, scan it in.
Okay,
Um,
take a picture of it on their cell phone?
oh yeah, we've got that too, and
Okay.
we've got a site where they can, we do everything we can so that they do not have to come into the office. I mean, they can pretty
Sure,
much
your
do
phone.
everything from home now.
Yeah.
Yeah.
Great.
So, I kind of like to brag a little bit. I like to remind my PA team that Knox is the best. We really are the best. Knox County really is the best. I mean, if you look at the C8, anytime that they want to figure something out, or, hey, we need this done, they always look upon Knox. And we have also helped the other counties get their timeliness up in their different Ives, because we tell them this is what we do, try it. I mean, we really have it down packed and it's really works well. We're held accountable by the state for application timeliness. And I'm proud to say that we consistently exceed our expectations. The state requires 95% timeliness rate for SNAP applications.
Mhm.
Knox County's average for 2024 is 99%.
Right,
Great job.
Yeah, good job.
good job.
Your people.
We're also held accountable for IVES. IVES stands for Income Eligibility Verification System. It's an alert timeliness. It tracks matches from the IRS, Social Security, workers' comp, and unemployment. Our average for IVES is also an impressive 99%.
Wow.
It's funny because our team says, no, 99 is not good enough, we need 100. But we always strive for 100, but we end up with the average 99.
That's a great culture you created.
Well, I see you did 100% in March of last year.
I know, we celebrate when we have that 100%.
Well, but I think what impresses me about you and your team, I mean, the numbers are important. You talk about the hits, which is the state and the federal guidelines and thresholds where if you don't meet certain performance outcomes, and there's, some technical assistance and some advice from our friends there. But your urgency is more about, well, if we don't answer this call today, if we don't process this application, and that's another day that this family has to go without so and such and such support. And that's what has always struck me about the urgency that you communicate to your team, is that it's not necessarily about statistics, it's mostly
Right.
about putting those resources and supportive mechanisms in the hands of families in our community as soon as possible.
Because we always say they wouldn't have applied if they didn't need it now.
Right.
So that's what the workers more or less say. They need it now, so we have 30 days, but we never wait 30 days. We do it immediately.
It used to be that families would tell us they would move here from other communities because they knew
Do they get it quicker?
that they
Yes.
get it quicker, and that the whole process is friendlier and, and more productive in terms of meeting their needs.
We strive to make that consumer happy. I mean, that's why we're here, to help them, and that's what we strive to do.
Well, thank you.
Yes, great job.
Great job.
Thank you.
Thanks very much.
He's already out there.
He is.
Yeah.
I'll give that other handout that you guys were looking at.
This one?
Yeah, you were saying some of those other numbers and stuff. But
Sure.
on what that would help.
And, you know, if you have any questions or you want to publish whatever, just reach out
I'd
to
like
one
to
of
have a
both of
copy
us.
while you read too.
Okay, I can't give you mine because I wrote all over it, but I.
That's all right, just give me copies of it. With
Here,
yours,
just email it down. to
with
us.
your notes.
Just
Yeah.
email-
Okay,
just
I'll
email
email it.
Yeah, good,
Oh,
thank you, thank
Thank
you.
All right.
Thank
Have a
you.
great day.
Appreciate
Thank you very much.
Okay, I was gonna say, because I can make it.
So next we have our dog warden coming in, Brian Biggerstaff.
Brian.
Morning, sir. Yes, you're up and running, yes.
All right, the monthly report for February 2025, we had 40 dogs enter the shelter. 12 of those were owner surrenders, 19 were strays, 8 were seized or custody dogs, and 1 was a returned adoption. And we had 35 dogs leave the shelter in February, 13 were adoptions, 3 were euthanasias, 17 were returned to their owner, and 2 were transferred out. And it should be noted that all 3 dogs that were euthanized in February were at the owner's request due to the dogs being aggressive or having a bite history. And as of Wednesday, March 19th, there were 23 dogs at the shelter. And out of those 23 dogs at the shelter, 20 were available for adoption. 2 have been adopted and are waiting to be spayed or neutered next week. And then they will go home to their owners. And we have 1 that is waiting to be picked up this afternoon. So, and then there is a total of 9 dogs at the shelter that have been at the shelter for over 60 days. And we issued a total of 11 citations in the month of February. Deputy Brian Weiser issued 2 citations for failure to license and 2 citations for failure to register. And Deputy Moore issued 4 citations for failure to confine, 2 citations for failure to register, and 1 misdemeanor charge of animal neglect.
And then I know that the dogs were being read to. Have they been able to be tested to see if their reading level has increased since the last time?
So we've had no ability to measure that at this time, but the WAGS program has still been going on every other Saturday. So,
Okay.
Yep.
And then that's done by certain elementary school kids? Or is
I
it
believe it's
stays-
middle school.
Okay,
Middle school kids, and yep, at the middle school.
and then what are some of the other volunteer programs that are helping out for
Yeah,
walking the dog?
sure. Yeah, I mean, we have a great volunteer staff that come in and walk the dogs. We have volunteer staff that just come in and hang out with the dogs. And then we also have different groups, the Dogs of Knox Donation Fund and the Friends of the Knox County Animal Shelter that also donate to medical expenses for the dogs. They sponsor training for dogs that get adopted out that might have some just behavior issues or just need worked with, or puppies that haven't had any formal training. And so they help sponsor those trainings and have been willing to pay to, help facilitate those.
And if someone wants to donate dog food that's still good,
Yep.
what's that process for
Yep.
them to do that?
We will always take in donations and they can just bring them into the shelter. And we just appreciate the community and how much they help, provide for us, the shelter's needs.
And your hours are,
Yep. So we're open from 10 to 4, Monday through Saturday, but we are there at 8 a.m. and donations can always be left in the front of the building. We have a little overhang. So if it's only evening hours, they can stop by. They can always drop them off at the shelter.
good for people to know. Any other questions?
No, I'm good.
All right.
Yeah,
Thank you,
thank
guys.
you.
Have a great day.
Brian. Yes.
back in spring.
Commissioner, we only have a couple items for you today. We need to approve the Delaware, Knox, Marion, Morrow Joint Solid Waste Management District Solid Waste Management Plan. This is the 5-year update, and Jenna was in here last week, I believe, and talked to you about that plan, and this is a resolution for Knox County to join with all those other entities in approving their 5-year plan.
Motion for that?
Motion approved.
Second it.
Those in favor say aye.
Aye.
Okay, then we have a stack of documents here to approve the bid and contract documents with McConnell Contracting for the Pleasant Valley Road Bridge. This was $868,840.95. And the county engineer has reviewed everything, and that's his recommendation. And it's ready for adoption.
Motion to approve.
Second.
All those in favor say aye.
Aye.
No, I've already signed mine. There's some spots in here.
Were you allowed to do that before we?
Yeah,
approved it,
because
Jason?
my signature doesn't mean anything. You don't approve it.
Yeah, so Pleasant Valley Road Bridge is, so those people who frequently use Pleasant Valley Road need to be making different route plans here before long, because once we approve this contract and get everything signed, then it's gonna be one of those things that that road is gonna be closed, and you'll need to figure out alternative routes to deal with Pleasant Valley
I think
Road.
just go sign this.
So,
We have one
Jason.
other item.
Yes.
Commissioner, so this isn't for you to adopt, just to enter into the record. Commissioners, like, I believe it was last year sometime, the US Board of Geographic Names reached out to us and the townships about naming or renaming a specific creek along it's called Dry Creek, along the Knox County, Morrow County line. And they were asking for county input, and we basically deferred and said, whatever the townships want to name it, they can name it. I have no idea why, but I got an email and they named it Conway Creek. I don't know what the significance of Conway, but I just want to have anyone this entered the record, the map, and it's the history of the area and where it's located. And this is in kind of Bloomfield Township, Liberty Township, right in that area. So it is now officially Conway Creek on the maps, and this is the US Board of Geographic Names letting us know it's approved. And so you don't have to adopt this, but if you just give that to Penny.
do we then ask the Liberty Township trustees to do a ribbon cutting ceremony? Or that, Cheryl, you can take that back to your trustees.
First time heard of it.
Yeah. So,
Mentioned it at the town meeting.
and that's all we have today, Commissioner.
Okay. Anything,
Good.
Barry and Trenda, you want to share with the people?
No, not really. I'm got a lot of meetings coming up, but nothing right now.
Same with me.
Well, I'll take a motion to adjourn. Then.
Motion to adjourn.
Second.
So we are officially adjourned at this point. Everyone have a good weekend.